Depo-Provera, Medroxyprogesterone. This is an example of a Provera medication label.
Medroxyprogesterone is indicated for use to treat amenorrhea in women who are not pregnant and are not menopausal. If you have missed or have irregular periods, then medroxyprogesterone may help you get your reproductive health back on track. Medroxyprogesterone may help with abnormal menstrual bleeding as well. Medroxyprogesterone works by preventing overgrowth of the uterine lining and working as a synthetic progesterone hormone. For both of these uses, medroxyprogesterone is usually given PO or orally. While there are many uses for medroxyprogesterone, the most common use for medroxyprogesterone is for pregnancy prevention. Within this use, medroxyprogesterone is usually administered as a subcutaneous or intramuscular injection at either weekly or every 3-month intervals. This can be done in a doctor's office or also at home. When used appropriately, medroxyprogesterone can be 99% effective in preventing pregnancy. Medroxyprogesterone works to prevent pregnancy by preventing the growth and implantation of an egg during the menstrual cycle, as well as thickening vaginal secretions to reduce the ability of sperm to fertilize an egg.
As a patient, it is really important that you choose to be an active participant in your personal health care. This helps to ensure that you receive the appropriate treatment and you and your doctor can kind of help to guide your health care to help achieve the goals that you are wanting. If you would like to wait like 5 years to have children, or if you want help just preventing children for the time being, your doctor can help you by offering appropriate medical solutions and medications that follow your goals. Make sure you remember to go to your regular medical follow-up appointments, as they will be required while taking this medication. This typically includes a yearly physical and a pelvic exam, as well as a pap smear. Those are all very important to receive annually. Let your nurse and doctor know if you are experiencing any signs of an ectopic pregnancy, such as intense cramping or painful abdomen pressure, as that can be life-threatening.
Oral tablet side effects include abdominal or stomach pain, absent, missed, or irregular menstrual periods, anxiety, blurred vision, breast pain or tenderness, changes in skin color, chills, clay-colored stools. Having the medication given as an IM or sub-Q injections can have some side effects too. The side effects can include abdominal pain, bloating, decreased interest in sex, depression, dizziness, and headaches. It is very common, at least at the beginning, to experience some irregular bleeding that can last through the first injection. Breast pain or tenderness is also possible. If you have a history of blood clot in the leg or the lung, make sure to consult your primary care provider.
These images shown are just a few of the side effects or adverse effects that a patient taking Depo-Provera could have.
The following information is important to know before taking medroxyprogesterone. If you're receiving this injection, the injection form, you have to go to the doctor's office every 3 months in order to get the injection. If you miss a dose, make sure you get the injection as soon as possible. While waiting to receive the missed dose in the meantime, make sure you use a non-hormonal form of birth control like a condom or diaphragm with spermicide. If you haven't received a dose in over 14 weeks, it is possible that you can get pregnant. The drug does not prevent STIs, so make sure to continue wearing a condom during intercourse. And then it may take some time after discontinuing Depo-Provera before you are able to become pregnant. Before taking medroxyprogesterone, make sure you let your doctor know if you're taking aminoglutamide, anticonvulsants, or steroids, as these medications can diminish the effect. To ensure you're not pregnant before starting Depo-Provera, a doctor will confirm your pregnancy by having you take a simple urine test. Make sure to tell your doctor immediately if you become pregnant or are considering getting pregnant shortly after taking medroxyprogesterone. Also, inform your doctor if you experience any continuous or heavy breakthrough bleeding. Breakthrough bleeding is a normal side effect of the medicine, but it should not be continuous or heavy. And then also make sure to inform your doctor that you're taking this medication, that's any doctor you see, as it can affect the results of some medical tests.
This image shown is what Depo-Provera looks like out of its packaging. It comes with a syringe and a vial that contains the medication itself.
Do you lead a busy life and cannot remember to take a pill every day? Would you like to decrease the uncomfortable symptoms associated with your menstrual cycle? Then Depo-Provera may be right for you. Talk to your doctor to see if this might be the right birth control option for you. Do not take if you are already pregnant or suspect to be pregnant, if you have an active or a history of thrombophlebitis or cerebral vascular disease. It is also not indicated for a known or suspected malignancy of breast, known hypersensitivity to Depo-Provera, liver disease, and undiagnosed vaginal bleeding. Do not take if you're allergic to progestins. Depo-Provera has a black box warning stating that the drug should not be used for long-term treatment, more than 2 years, as severe loss of bone mineral density may occur. Discuss with your provider any over-the-counter or other prescribed medications you are currently taking, including herbal remedies, as it has been found that herbal products such as St. John's wort can interact with the effectiveness of Depo-Provera.
These are the references that we used to create our Depo-Provera teaching presentation.